I'm Dr.Leela Mohan. I'm an MD physician. I practice diabetes. I have my own center in HSR Bangalore that is called as Padithem Healthcare, and then I'm consultant in motherhood and Columbia Asia on Sarjapur Road. Diabetic gastroparesis. So what is this diabetic gastroparesis? Diabetic gastroparesis is nothing but which causes food delaying. That means the food stays in your stomach. Mainly it happens in diabetics. Why it happens in diabetics? That is, there is a thing called as peripheral neuropathy and polyneuropathy. The nerve endings to the stomach will not be responding properly. So that is the reason the delaying and emptying of the food occurs in the stomach. That means the food stays in the stomach for the long time. So what are the main symptoms of it? Symptoms of it are mainly like acid reflux, where you will feel throat irritation and the acidic thing in your mouth, and then delayed emptying also causes stomach bloating, which will cause abnormal abdominal discomfort, and then loss of appetite, because the food is already there in your stomach. So you usually feel that your stomach is full, so you won't feel to eat. So because of that, what happens? Complications like malnutrition and dehydration also occurs. So what will be the treatment for this? Basically, there are certain drugs called as metoclopramide and some other medicines which we usually treat for the diabetic gastroparesis. Drugs like diphenhydramine and all we usually give it, and then as in the treatment I had told, avoid the fibrous fruits, all those things, and raw food. You should always have the cooked food, which will be better, and taking insulin on timing also will help in preventing the diabetic gastroparesis. So the insulin should be taken after food rather than before food. So that will be usually help in the diabetic gastroparesis. And as a natural remedies, what we can do is eat frequent meals and have hot soup or sour soup, and then drink lot of water, and then eat more in a different timings, like slow timings, not in a once at a time, and then have a small frequent meals, give gap for 2 hours or 3 hours, and then drink lot of water as I said, and then have hot soup. Morely you prefer the liquid diet than the normal diet. So this is how we can treat the diabetic gastroparesis.